Hello, welcome Shravani. Welcome to
Hello,
Praanwellness.
Anshu.
Welcome to
Thank
Praanwellness,
you for
Real
having
People,
me.
Real Stories session. And thank you for accepting the invitation. So happy to have you. And yes, our viewers also will have a very insightful session from, experienced person like you. So let me introduce Shravani first. She is a queer affirmative counseling psychologist, and her work relates to gender issues and gender concerns. I would pass on to you, Shravani, to have, give an introduction about yourself and the work that you're related with.
Okay, so thank you so much for that, Anshu. Let me just briefly introduce myself so you and everybody would know what we're dealing with, what we're starting on here. So my name is Sravani, Sravani Rudrapati. My pronouns are she and they. I will go ahead and then we'll come to that part, like what exactly does this mean and all of that. But my profession is that of a queer affirmative counseling psychologist. You can also call me a QACP practitioner. Just a little bit about my background. I have done my master's in applied clinical psychology from Tata Institute of Social Sciences. And later on, I went on to pursue a certification course from Mariwala Health Institute. And that's how I became a QACP practitioner because I've had training in that. And after that, majorly my work generally as a profession involves around addictions and substance use, trauma, a lot of mental health concerns, common mental health concerns, depression, self-esteem issues. So this is what majorly my work entailed while I was working with Lim Hands for almost 1 year, 6 months. After that, and during the same time, I was also doing my own private practice. I practice in English, Hindi, and Telugu. So my Hindi, I mean Telugu is my mother tongue basically. But majorly, I also work a lot in the area of gender, sexuality, and also a lot of, again, sex, gender area, all of that area. So, just going back to when I started it, I think it's been almost 3 years since I've started doing all of this. I passed out in 2020. My master's, I was done with my master's in 2020. I was the last official batch to do offline. So yeah, after that, it's been a round of and a range of internships, trainings, again, private practice,
Mhm.
so it's been a lot of that,
Okay.
Anshul.
So my curiosity was, your area of work, especially related to the gender issues and the gender identity concerns and all. So how did you start your journey, with this area?
Um, I think a lot of the work that I do and the journey that I am on currently is very personal to me. As
Okay.
much as I am a professional, my journey with gender and sexuality started much, much earlier. With regard to, me questioning my own self, like my own beliefs, my own sexuality, my own identity. So I can
Mhm.
call it like, it's much more personal than professional in between.
Okay.
So it's more like, there's a lot of like internalized homophobia with regard
Mhm.
to myself, like I think it was around maybe class 10th that I
Mhm.
started I started like having these questions of who am I attracted towards as a person, because again if you look at the major what do you call this social media and how movies and everything is depicted
Right.
as, there's no role model for you. Like all you
Mhm.
see are like heterosexual relationship, a man and a woman, a woman
Yes.
and a man falling in love, and that's how it goes.
Mhm.
But again, as a young person who was growing up, and then you have all of these questions because, like, again, at that time when you're coming from like a very uh, Indian conservative middle class family,
Mhm.
there's no roadmap for you to sort of fall back on, right? So obviously, I grew up with these questions, a lot of self hate, a lot of criticism for myself. That's how it
Mhm.
started as. And I think thankfully, somewhere down the line, I did find community support that came much later on. But I think
Mhm.
it started in class 10th for me personally,
Yeah,
and then
that would be a
11th and
very
12th.
hard time, right? For you as a
Definitely,
growing, yeah.
definitely. Right.
Mm.
I think, it's all these shifting cities, and you are a teenager, and then a lot of things
Mm.
are going on around at the same time, body image, and
Yeah, too much
figuring
of
out
mental
career.
conflicts happening.
Exactly,
Yeah.
exactly. So that's how it kind of like started off. And then,
Mhm.
I was shifted into a all-girls school later on. I was in Loreto Convent in 11th and 12th. And, that's when, again, it's this period of converting to a young adult, right? So just
Mhm.
because sexuality and sex and all these talks are not talked about, it doesn't mean they,
Yeah.
they cease to exist, right? So I think that's how it started off as. And then, afterwards, I was in LSR, thankfully, Lady
Mhm.
Sham College in Delhi. And that's where I believe I found representation, where I found validation, where I found, that there are people like me, and then all
Mhm.
of us come from the shame, the shame and the same shared stories, right? So I
Mhm.
think that's when you start to, what do you say, look around, and then you see that there are people who are like you, and
Right.
then you kind of like, you know, try to try your best to move away from that shame and guilt and isolation. So
Right.
that's how more or less my journey was started.
And get the
And after
acceptance,
that,
right? Accept the
yes,
way you are. Huh.
yes, I think that's definitely a work in progress. There's never
Mm.
a start point and an end point, very honestly. But after that, again, when you move on to become a profession, I've chosen psychology, as my profession long back. And
Mm.
after that, even in my masters, when I did my clinical psychology, my thesis was
Okay.
in the area of LGBTQ. And it was, precisely it was about, a phenomenological inquiry into the lived experience of Indian gays. It
Mm.
was with regard to the same topic, that how does acceptance comes into being,
Right.
especially, my population was South Indian, people who, and then the sample was also, Indian families, right?
Okay.
Like if
Mm.
I consider myself to be a gay, and then
Mm.
I tell my parents, and then what conflict ensues,
Yeah.
what exactly happens after that? How do I, come to terms with it myself, and then how do other
Mm.
people, come to terms with that? And then that's been
I think that's
very
the harder part.
insightful. Yeah, definitely. It
Mm.
was very hard also, because it's not easy to go to a family who are just still not accepting, but who are trying to accept. And then
Mm.
it's like you're throwing a stone in the beehive. You're getting
Yeah.
all the you know. So it was a lot like that. But then again, as I was saying, it was a real insightful experience for me to see
Mm.
how other people's journey was. I can't exactly say it's positive all the time, because very
Yes.
honestly, there were people who have been literally thrown out of their houses, who've been,
Mm.
again, trigger warning, who've been abused, and been subjected to all sorts of things, right?
Yeah.
So that's how the journey started. And then, just safe to say that it still continues, whether it's in my
Mm.
professional work, in my volunteer work, in my personal work. It's been a journey. So
But it's
yeah,
so
that's
strong of you, Shravani, to take up that area to work, and also come on Praanwellness and talk about it, so that others also get motivated and just kind of get a motivation or inspiration, whatever you call, to just accept the way they are first.
right,
Maybe that's where the
right. I
thing
mean,
begins, right?
exactly, right. Because that's what, like, one of the main factors of non-acceptance,
Mm.
is other people, right? Like,
Yeah.
unless and until they understand where you're coming from, they understand what you are, right? It's
Mm-hmm.
kind of like, it's a difficult thing to
Yes, to
kind of
put in words, I guess.
yeah, yeah.
Okay.
So I guess we have to start somewhere, right? And
Yeah.
then, as I was saying before, that that role models. If I
Mm.
know that this talk is gonna go and help some other young queer out there, that it's totally okay for them to have these feelings, and it's okay whatever and however they are. It's
Yes.
for the good of the community. So that's why
Yes.
I'm here. And
It's
then thank you for
it would
calling
definitely
me
help
here,
many
Himansh.
people. Yes. So,
Right.
because you understand this area so well, I just wanted you to, put in simple terms, because there's a lot of, confusion or lack of awareness between certain terms like gender, gender identity, sexual
Hmm.
orientation. So, if you can put it in just simple words to people to understand.
Right. So again, let me just take LGBTQ, right?
Mhm.
So L stands for lesbian, as in like
Yeah.
a person, somebody who is a woman, or
Mhm.
a woman being attracted to another woman. You know,
Okay. Mhm.
now this can be not necessarily that this is a woman by typical societal standards, which mean it does not mean to say that the person has to have a vagina. Even if I do have other characteristics, sexual characteristics, I can
Mhm.
consider myself a woman, right? So
Okay.
it's like that,
Mhm.
right? So any
Mhm.
sexual, emotional, attraction towards another woman, yeah. So that
Mhm.
is lesbian. Now these are what we call sexual orientation, sexual attractions, right? So
Okay.
again, G stands for gay, right? So that
Mhm.
is also somebody who identifies themselves as gay, is that I'm attracted to other men or other
Mhm.
people who are in the same spectrum, sort of. So again, LGB is bisexual, T is
Mhm.
transgender, and Q is like queer. It's like an all-rounder, like an umbrella term for
Okay.
everybody who is not a homosexual. I mean, who is not a
Okay.
heterosexual. Okay, so
Mhm.
all the homosexuals under one branch, as in
Okay.
heterosexual is somebody, like there are two things for you to understand here. Okay, first is
Mhm.
gender. Okay,
Mm.
so
Yeah.
gender is something which is culturally constructed identity,
Right.
which revolves around notions of what masculinity is, what femininity is. For
Mhm.
example, let's just take a simple example. Like if a baby is born, right?
Mhm.
So what happens? The nurse or the doctor or whoever, they check the so-called, you know, parts of the baby, and then they'll be like, oh,
Mhm.
there's a vagina, so what, it's a girl.
Well, yeah.
It's not,
Okay.
it's a penis, then what, it's a guy.
Mhm.
That's how generally they are boxed into binaries.
Okay.
So what we stand
Mm.
for is we go beyond those two boxes of binaries. you
Mm.
know
Right.
so that's one thing. That's what gender is about, basically. And then there comes gender expression. Like, for
Mhm.
example, look at me. Generally,
Mhm.
if somebody looks at me, and they'll
Mhm.
be like, what, she looks like a girl because I
Mhm.
have breasts and so-called things that are identifiers, right?
Mhm.
And but exactly what is perceived may or may not be what I myself perceive as, or what I look at
Okay.
myself as, right? For
Mhm.
example, I use the word, I might pronounce as she and they, right? Which means
Okay.
I identify as somebody she. I'm okay with being feminine and being a female.
Mhm.
But at the same time, there's also the word they, which means
Mm.
I do not consider myself a part of either a male or a female, which means I am
Okay.
non binary. I do not consider
Mhm.
myself into both those boxes. Yeah.
Okay.
So that's
Okay.
something. And uh, so gender expression is basically, how I convey my own identity. you know
Right.
I may choose to have a small haircut, I may choose to have long hair, I
Yeah.
may choose to talk in a certain way, dress in a certain way.
Mm.
So it's all on me, how I choose to express what I am.
Right.
Yeah.
Okay. So
So
it's a
that's another
personal
thing.
choice and what I feel inside as, my identity.
Right. Right.
Right.
That's my
Okay.
own gender identity,
Mm.
exactly. So how I feel inside and what I
Mm.
believe I am. Yeah.
Okay. Okay.
So
Thank
right.
you for
So that's
clarifying that.
another
I had that doubt when you use the pronoun she or they. So, okay, thank you for answering that. So, Shravani, next question is, I think you have answered most of this. When and why did you feel the need to advocate for the gender issues and gender identity area?
Right. So, as I was talking about, it was very personal for me. It
Personal,
was
yeah.
very individualized for me before it
Mm.
became sort of like a profession and, all of that. But, not just that. I think we as queer folk, queer and trans folk, we are literally at the helm of a lot of stigma, a lot of
Mm.
marginalization. It's not just individual, but also it's very systemic.
Right.
Systemic in the sense that the entire system, whether it's the legal system, whether it's the society, there's always this othering that happens. It's like us versus them. It's like the
Yeah.
homosexuals versus the heterosexuals.
Right.
It's always been the case because
Mhm.
people generally maybe are afraid of what they don't know, or like they come with their own set of ideologies and their own biases, right?
Well,
So
right.
that's something that I always have personally perceived, right? Even
Mhm.
let's take my own example, right? Like, for example, if I tell in 11th and 12th, right, if I tell any other friend of mine who is a
Mm.
cisgender, in the sense that, again, I'm clarifying terms as I go,
Yeah,
just so that it's
yeah,
to
please do so,
understand.
because we do need that. Yeah.
Right, right. So cisgender is somebody, like for example, somebody's born a female, and I'm okay
Mhm.
with being a female, and
Mhm.
and I consider myself to be a female, right? And
Okay.
that's how I go on. And their
Mhm.
orientation is also, let's say, straight, as in they're attracted to other genders, yeah, which
Okay.
is typically male, right? So
Mhm.
if I go and tell, let's say, one friend of mine who's a cisgender, then they'll be like taken aback. They'll be like, because there's
Yeah.
something they've never seen before, maybe. They'll be like,
Yeah.
what is wrong with her? Or they'll probably start avoiding me, or they'll be like, what if like she has a crush on me, and then stuff like that. So
Mhm.
that
Yeah.
is how discrimination happens. That is how
Right.
isolation happens. And
Mm.
then obviously all of these things, and then again, as you go ahead, there'll be bullying, and there'll be a lot of stigmatization, there'll be a lot of talks, and that, what,
Mm.
she's that, she's this, and all of that. And that's how the mental health of the person deteriorates, because they
Yes.
do not have a supportive community. They do not have people
Mm.
to understand them, right? So
Yeah.
that's how things happen. And all the more reason why we need to advocate, because again, although there are a lot of people who don't outrightly express that they are queer, the fact of the matter is there are. If you look at
Yes.
statistics, there's a
Mm.
huge number of population of queers that exist, and all of these
Mm.
people, they need to feel that they are normal, and then they are okay, and then it's very, very, very normal, right?
Right.
So
Right.
that's the basis of why we do, June as Pride Month, and
Mm.
just to put ourselves out there that, what, we all are worthy of, just being us, you
Yes.
know.
Just being us. Yeah. And to
Right.
normalize things is, I think, the most difficult part to do. Right. And especially,
Yeah.
as you said, of, stigma associated, the shame associated. Being in the society like ours, the culture is so diverse, and then there is stigma associated to just a basic mental, psychological issues. And then
Hmm.
talking about such a sensitive area of gender differences, gender diversity. So obviously the challenges, I can't even imagine what it could be, but can you just
Right.
talk about the major challenges that you face, since you have been working in this area since 3 years as of now? So what are the major
Hmm.
challenges that you face, and it's still hard to overcome?
Right. I think, as I was just, as we were just talking, I was talking about how it's not just individual, the distress and the problems that we speak about, but these are also very systemic in nature. You might
Hmm.
have heard about Section 377, and then,
Right.
how being a homosexual itself was a sin and was wrong
Yeah.
according to law and all of that. And then how we're
Hmm.
making progress onto that, right? So not only is it very systemic, but it's also
Hmm.
very individual. Like, there's obviously a lack of support, there's lack of understanding, there's
Right.
lack of resource, there's lack of access to quality mental health care, because even
Yes.
a lot of professionals out there, like for example, let's
Hmm.
take doctors, right?
Right.
So if a lot of people feel unsafe to go and tell somebody that, what, I'm queer, or I'm bi, or something like that, because
Hmm.
you know the discrimination is not just singular, it's not linear, it's multifold actually. Because
Yes.
again, conservative and
Hmm.
taboo, a lot of things. For example, if I have to get quality, sex ed, it's not there. And if I
Hmm.
have to go and consult with somebody about anything, you know, especially with regard to sex and all of that, it's frowned upon. You look down upon.
Right.
So where are you supposed to go with all of that?
Hmm.
Right? So that becomes a systemic barrier. Healthcare is a barrier.
Right.
Legislature is a barrier, and you can't be open about who you love. You can't hold hands. You can't touch people. You can't talk about things, because why?
Right.
Uh, you know,
Hmm.
religious beliefs somewhere or the other comes into fold.
Hmm.
It's considered unnatural, which is not the case at all. And then
Right.
just because you put yourself out there, right? Like, I'm sure that even right now, even in this month, a lot of people who want to be there for the younger queers out there, they put themselves out there in a very unsafe position, right? And then
Hmm.
they'll be the subject of mockery,
Right.
degradation, and it's
Hmm.
actually a threat to a lot of people's lives. And despite
Yeah.
that, we have to go. Why? Because we seek that acceptance, because that's something that should be given to everyone. These are
Right.
just some of the challenges that we face with, and all of these coupled with mental health challenges. You know,
Yes.
we hear about depression, death by suicide, and
Hmm.
all of these are challenges that are perpetuated by,
Right.
again, bullying and
Hmm.
stigma, cultural barriers,
Isolation.
and
Yeah. Shame.
just keep going on. Like the list
Right.
is just very vast. So, and
Obviously, with
obviously we
that many challenges, how would a person open up?
right,
Right?
exactly.
How would I open
Hmm.
up if I have to tell, okay, I'm a gay? How will I tell it? Even to my family members.
Right. And, that's also the thing that you have to provide the safe space first. You, as in a society, has to
Hmm.
provide that safe space first, because, you can't expect me to come to you
Right.
and then tell you and then you make a safe space for me. That's not how it
Hmm.
works, right?
Right.
The
Right.
person should feel safe and kind enough, and, all of that, to be able to open up and then tell them that, what, I'm having this problem, or, this is what I need. So I think the
Hmm.
onus is always on the queer person. So the
Right.
labor is supposed to be done by the queer person, when it's not the
Hmm.
case, right?
Right. Right.
The safety net is supposed to be given to the person. Yeah.
Hmm.
So just
So, Shravani, you were talking about the major challenges that you had to face. So,
mhm.
as an individual or as a counselor, how do these challenges affect you?
So apart from being not only a queer individual but also a professional, I think
Mm,
it's rather a challenging job, because
right.
you're actually dealing with lives of people, and issues like sexuality and gender, and all of these are very real, and if not understood properly, or if not you know if you if like for example, if there's a psychological first aid kind of like a situation, and then if the person doesn't get what they need at that moment of time,
Mm,
it's actually a question of life and death. So you
yeah.
literally have the uh, lives of people in your hands, per se, right? So it's something
Mm,
which is very challenging. It's also scary, if I can be honest, but at the same time it's also very uplifting to know that you can help these people, and you can actually come through and then be there for your own
right.
community and society, right?
Mm,
So in terms of challenges for my own self, I think it has a lot to do with uh, a lot of overwhelming feelings, because
mm,
progress is slow, and um like I have personally lost out. I mean, a lot of my friends, who have died by suicide because they couldn't get the care that they needed at that point of time, right? So it is indeed a very tough situation. So all you can do is, there is definitely a chance that you work yourself to the bone. You push yourself to do all that you can, and in that point of time, you neglect taking care of your own self. So definitely, burnout is a very, very real possibility that can kick in. you know
mm,
and also, like, personally, I sometimes question myself that, what am I doing enough? Is this the best I can do? In what all different ways can I be helpful to other people, or so that is a constant thing that kind of like goes on in my head. um and that's why it's very important for you to take breaks and recharge yourself, and
mm,
reach out to a community of your own, you know
right.
and obviously, what I do generally is I take therapy, you know
Okay. Mm-hmm.
so it's a very normal thing, to go for therapy, right? Like, therapy, supervision, personal work,
Mm,
all of these are certain things that we do. Taking time off for yourself at least weekly once, recharging, doing things that you like, going out on
yeah.
picnics, drawing,
Mm,
self-care. This is something that I do. But at the same time, also, actually holding yourself accountable, checking,
mm,
if the path that you're going on is right, you know. So all of these are things that one can do to not only keep
right.
us and ourselves on track, but also help ourselves from being exhausted, from being burnt out, and
Yeah.
all of that.
like take some me time.
Yeah, sure.
Yeah.
And also, I think what generally helps is also just to look back and all the progress that you have personally made as an individual,
Yes.
and also whatever in whatever capacity is it that you've helped other people.
Yeah.
Because it really is very, very heartwarming if somebody
Mm.
comes up to you and they say that, what, whatever I've needed in that point of time actually came from you, or I've
Right.
seen something of yours, and somebody gave this number of yours, and I really, really needed to talk to somebody at that point of time. And then, it actually helps that you're making that
Yeah.
difference and actually tangibly seeing that, or
And
somebody saying
motivates
that,
you, right?
you
And
know,
motivates you to keep
exactly,
doing, right? So like,
exactly. And what
mm,
I personally do is, just writing these personalized notes, or like
mm,
snippets of notes for myself, and just keeping them in a jar or something like that, so that I can go back to them and
oh,
reading them, or just feeling them when I am personally feeling down or
right.
demotivated. That kind of
Mm,
helps me going.
that's a great
So,
idea.
hey, that's something I do.
Yeah,
I mean,
yeah.
people can go about
Right.
different things.
Okay. So as you also spoke about, these little things that you do, take a break and writing small snippets about you, keeping it and coming back again when you feel. So I think these are certain, what else can you say that, are your coping strategies when you are emotionally distressed, because the challenges that you come across on a daily basis as an individual plus as a counselor. So what are your coping strategies?
I think, again, being in therapy myself is
Mm,
something that is very helpful,
right.
because um, we all come from some trauma or the other.
Yes.
Sadly, that's how,
Mm,
the state of the world is. And working on yourself, and looking at all the growth that you have done and all the growth that
mm,
you need to go is something that I do. Obviously, by the help of my own therapist. And apart from that, taking supervision. For example,
right.
if I am, let's say if a client is there, and then if there are certain things that I am missing out on, or like if there's something that I can do better, right?
Mm,
Then these are certain suggestions that my supervisor would give me, that what, you're looking at this from this angle, so what about this,
okay.
is there something that
Mm,
you've missed, so
right.
whatever is the best efficient way to
Mm,
talk to the client, or so that we can sort out whatever it is that they're feeling, their difficulties. So so
mm,
obviously supervision is also another very core important thing.
right.
And third is, again, peer supervision, right? That's also another
Mm,
thing that I generally do.
okay.
And again, connecting to my community. That's a
Mm,
very, very important thing.
very crucial.
Going
Yeah.
on, exactly,
Mm,
very crucial, going on volunteer programs, or, just doing anything so that, you're attached to the same community you belong to. It can
mm,
be very therapeutic in itself, you know.
right. Right.
So yeah, these are just certain things that I personally do. And
Okay.
obviously, when I need to like recharge, take my own time and all of that.
Right.
Yeah.
So being in, counseling yourself and the sensitivity of the topic that we are talking about, plus the context of Indian society that we live in. Uh, Obviously, there's so many biases and prejudices that we have from our own side. So, what do you think? How do you overcome that, or how can we overcome such biases?
I think it's very natural for human beings to have biases. That's one thing. But
Hmm.
choosing to work on those and not being
Right.
ignorant,
Hmm.
is something that all of us should address. Because again, as we
Hmm.
grow up, it's not like we're spoon fed all the time, right? Like after
Yeah.
a point of time, you have to go ahead and then do the talk and do the things by yourself.
Hmm.
So first and foremost in anything is getting that information, or going ahead and then seeking out information, seeking out resources on any topic, on anything
Hmm.
out there. So that's obviously the first thing. And for me to look out my own biases, again, as I said, therapy and supervision,
Hmm.
and me again rewinding and thinking back on things. Have I done them correctly, or is there any other way? And all of these
Right.
are things that one can take help of.
Hmm.
Um, yeah, yeah. So again, back to supervision, back to a lot of training. That's also another
Hmm.
thing. You have
Right.
to be trained. Especially as you were talking about in issues that are so sensitive and a
Hmm.
matter of like life and death.
Hmm.
So one has to be like really trained to be to have undergone these things.
Yeah.
Uh,
So that helps you, be self-aware of if you have any biases, shadowing you when you are yourself taking a counseling session, right? Okay.
right.
So one experience, if you could share, about any experience that you would like to talk about, you had encountered when working in this field.
I mean, experiences there's a lot, but I
That's
think
lot. Yes, obviously
sadly,
there are many, but if you could just
right,
share
right,
one.
right. So I think this is something which is again close to me,
Mm,
but also I think in large it also depicts the kind of what do you say, feedback, or not feedback, the kind of what is it, this thing that is meted out to queer people in general. Okay, so
mm,
this was way before I was I think I was in my undergraduation. This was back in Lady Shram College where I was doing my undergrad in psych and pol science. And I remember I used to live in a hostel, and then that was again coming from a place of just getting to be a young adult and all of that. I've had
mm.
this crush on a girl, and what happened afterwards is that this one time I was attending my lecture and in
Mm,
one of my classes, and then I got a call from some random number, and then I took up the call, and it was some man, some random person that I've never came across.
okay.
And he was like, I know what you are, and I'm telling you for your safety and all of that. I know how
Mm,
these things end. This was with
mm,
regard to the girl that I've had a crush on. That what, do not go ahead with that, and it's just
mm.
gonna end badly for you. I know so many people for whom it ends badly. So
Okay.
this goes on to explain that just
Right.
how much the society or males and everybody thinks they can have a say in your life. You know,
Mm,
call it call it the misogyny, call it the gender inequality, or whatever name you can give to that. But then how do you, or like how, like, what do you think? Like, it's my life, right? Like, you have
right.
no say whatsoever in talking about anything, and suddenly you come, and then this is something that I don't even know this person, right? And just randomly a
Mm,
call, and then they're like, what, this that it's not going to end well for you, and don't do this.
my
you know
God. Mm,
why? Right? So this is just one of the incidences that just happen to anybody. I mean, anybody, as in most of the queer people. There's obviously
mm,
conversion therapy, and although it's not supposed to be, but it's still happening, right? So
mm.
these are just one of the hundreds of incidences, negative incidences that are meted out to queer people on a daily basis.
Right.
So yeah,
So hard,
just
and
yeah,
I can just imagine how a person might be feeling at that point of time, but really too hard and too challenging for them.
right.
Thank you, Shravani, for sharing that experience. It's so strong of you to talk about that. And the last one thing that, a small suggestion or whatever you say, you would like to give to how we as individual or as a society be more approachable, because as you just shared the experience, people are not much, they don't know how to approach a person, they're not respectable, or they don't accept the person. So what are the what a small suggestion that you would like to give to to an individual or we as a society, how to be more approachable or respectful towards the queer community you're talking.
Right. So I think first and foremost, I mean, there's a lot of things that we need to still do, and it's a
Right.
long journey. But I think definitely some of the things that we can change in
Mm.
our approach is to be, to be kind. First of all, that
Kind.
is
Yeah.
something that I advocate. Regardless of who we're talking about, because
Yes.
kindness is a very virtuous trait, is what I believe. It doesn't have to be somebody from a different gender, different, caste, none of that. Just being
Anything,
kind
right?
enough to somebody, because you never know what is going on in the other person's life and how can this one small act,
True.
be helpful for them. So definitely
Hmm.
that is kindness is something that I advocate really, really passionately.
Very
And
true.
second thing is definitely, I've personally noticed that people are generally afraid and different towards what they do not know, right?
Yeah.
If let's say that you've never come across somebody outwardly who is of a different gender or who is of a different sexuality, then being open or
Hmm.
being open-minded, having that openness is
Right.
something which is always good. And also being respectful towards differences is another thing,
Right.
right? So even you don't have to understand it. You don't necessarily have to understand it for you to be respectful and for you to,
Right.
respect that differences
Hmm.
in other people, right? So being tolerant is
Yeah.
also something, right? So once I think you have these certain things down, maybe what you can do is to understand them better. What you can do is, one thing is respecting their space also, because a lot of people I've seen is that, especially in this month, they'll
Hmm.
be like, Acha, tell me about that. What is this? What is that? So you're supposed
Right.
to understand that you're encroaching their personal space. Like not everybody
Hmm.
is out there. Not everybody is willing to, because very
Right.
honestly, a lot of people are tired of doing this all the time,
Hmm.
and even then they met with resistance and all of that. Right. So first is
Hmm.
doing your own research, right? You are
Right.
accountable for your own biases. You are accountable for learning and all of that.
True.
So
Hmm.
there's plenty of information available online, and I'm not even kidding. Like it's
Yeah.
huge amount that's available online, right?
Hmm.
So go through that, and then be kind, be humble, be respectable, be respecting
Yeah.
of the other person's anything, right? So ask them. Like a lot of people, one of the questions that generally comes to me is that, how would I know that it's appropriate to ask, what do I call you? Because
Hmm.
again, this thing of pronouns come, and all of that.
Right.
So for example, you can call them by their name, or you can directly ask them that what is it that you like to be called as, right?
Okay.
So
Hmm.
they'll let you know that, what, I am she or they or her, anything.
Hmm.
So
Hmm.
that's another thing. And I think, again, this is also a pretty important point. It's not just the month of June, because we see a
Right.
lot of, rainbow capitalism. We see a lot of people doing things just to be, if I may use the word work, or just to be perceived as something. You know what? Yeah, I'm also like forward and, all of that. But I think actually caring, because again, as I said, you know, these issues are a matter of very sensitive, and genuinely a matter of life and death for a lot of people,
Right.
and actually going into the root cause and seeing what is it that we can do as individuals. For example, there's so much to be done, in schools. You can stand up for a friend. If you see that somebody is
Right.
being bullied, you can stand up there. You can
Hmm.
again, you can be kind. There's like so many things that can be done
Right.
with regard to that. But again, doing your own homework and doing your own thing, and being respective of the other people's boundaries and their pronouns, and all of that,
Hmm.
uh, and educating yourself about this. So these are some basic things that
Right.
we can,
Yeah.
very, very basic, but I think that does help a lot, you know.
Just very basic as a human, be kind towards other human being. That's it.
Exactly.
Be it
Exactly.
whatever gender, caste, or right, as you said, very true. Thank you, Shravani. That was a lot, but in a very short span of time, could hear so much things from you, could learn so many things from you, Shravani. Hope to see you again. And any other thing you wish to pass on through Pran Wellness?
First of all, again, thank you for having me here. And I'm sure if the opportunity permits itself, I'll be more than glad to be here again.
It's our
But,
pleasure to
as
have
I
you.
said, right, but I think as I was saying, let's be respective towards others. Let's be kind, and let's try and understand them. Not just because you have to as a professional, and not
Mm.
just because that's how the world is going towards. But actually wanting understand them, wanting to understand them. that's something I, just wish to pass on. Yeah, and be kind. Not just in the month of June, but
Yeah,
365 days.
yeah,
So
what we are, not just in the month of June, right? That's very true of you.
exactly.
Yeah. Thank you, Shravani, for sharing your experiences, your thoughts, your learning, so many new things you have told to us. Thank you so much, and it's a pleasure having you here. Hope to connect with you soon, so that we share more about into the topic, so that okay, even many people get to know just the very basic
Right.
things that we need to do as an individual. Okay. Thank you, Shravani.